David.
Thank you very much, Fiona, and thank you very much for listening to me. My name's David Hill. I'm from Belfast. I'm a clinician, originally anaesthesia by background. I do pain medicine 2 days a week, and the rest of the week I'm involved in improvement, R&D, and clinical governance. As a hobby, I lift weights, and I loved that picture that Kat had. There was 225 kilograms in that bar. I can lift 150. I just thought that it was important that there was no surgeon that I couldn't throw across the room. To give you some context, I work in an integrated health and social care trust in Belfast, which employs about 12,000. We have a population base of almost 500,000 now. We have one large acute hospital called the Ulster Hospital. We also have 2 other smaller acute hospitals, which we are in a journey of being reprofiled and are not really acute anymore, and they're more elective hospitals. I'm just hoping none of them are here to hear that. We also have community healthcare. We have primary care practices. We have care homes. We have children's homes. We have community paediatrics, because we are a social care trust as well. And we have a very ageing population. And I'm not going to feel ashamed to say that we do live in the wealthy part of Belfast, and that always has its problems of high expectation. This document came out liberating the NHS, and it had 3 great principles in it about focusing on patients and putting them first, enabling people to improve, and especially empowering clinicians to improve. And we decided to adopt this strategy in our trust, and we have encapsulated it in a phrase called SQE, Safety, Quality and Patient Experience. And as part of our strategy of embracing this, we have done an educational programme, and that's the component I'm going to talk about now. There are other strategies, but that's for another day. So we designed a programme to try and build capacity at the coalface amongst doctors, nurses, pharmacists, social workers, estates people to do with the buildings, everyone involved in providing health care and care to patients. We wanted them to develop an understanding of improvement science, but also for it not to be abstract, as Kat said, but it to be real and meaningful, so they're all involved in a project at their place of work to get practical relevance for them. We're now in the 2nd year of the course. The 1st year of the course, we had 55 participants, 11 mentors, and 15 projects were the output, 6 of which got published in the EBMJ, which was a great achievement. The 11 mentors at the beginning, they are senior doctors and senior nurse ward managers. Often at the beginning they had no experience in improvement, but we just made them a mentor as a way of tricking them into doing the course themselves. Now we have enough people to be mentors, but it was just a strategy to get people engaged in it. This year we've a lot more participating, and as you can see the output is even greater, and I presume it will grow as time goes on. This is the content of the programme. It runs over 9 months. 3 compulsory elements: Jessica's IHI online module with that certificate she showed. We originally did their generic open school, but we now have our own customised module to suit our purposes. We also have monthly learning sessions on a Friday at lunchtime, and as I've said, they're all involved in a project. At the end of the 9 months, we have a presentation evening. This photograph shows the winners of it last year. One of our renal physicians, Niall Leonard, and his team developed a very clever checklist to identify acute renal failure in an acute hospital, and this has been rolled out across our trust. The health minister is there, and our chief executive at the top of the pyramid. And I don't have time to speak about it, but a key success and driver of our programme is having the most senior people in the organisation involved in it. And having the chief executive and even having the health minister is a great benefit. I'm not going to go through these. These are the projects, some of them that they did last year. They cover acute medicine, acute surgery, social care, care of the elderly, disabilities, children. These are all examples of projects that were done and presented at that evening. The monthly learning sessions, these are examples of the topics that we deal with. We get industry to come, we get Caterpillar and the American generator business, who have 3 factories in Belfast. They use a lot of the improvement methods that we do, and it's fascinating because they're so much further on in their journey to hear them. I don't know if he's here, but we had Gregor Smith from Scotland who talked about primary-secondary care interface. We get people to talk about human factors and all sorts of things that you probably could predict. Now, we did quite an extensive evaluation of the course. I don't have time to show you it all, but I'm going to show you some of it. So the one over here on your right, they were asked, to what extent do you feel you'd learnt on this course from 1 to 5? And the purple is 5 out of 5, the light blue is 4 out of 5, and the lighter colours 3 out of 5. So the majority of people felt that they'd learnt. But the most encouraging for me was, can you use what you've learnt in your role at work? And you can see that almost 99% said that it was relevant for them in their day-to-day job. And I see that as the success of the programme. This is a framework of knowledge and skills. I'm not going to go through all of them, but it was to see whether they rated that their confidence and knowledge and skill base had improved as a result of the programme. The blue is before the programme, the red is after, and you can see that in almost every criteria, people have felt empowered and improved in all their skills and knowledge in the area of improvement science and measurement, which is very encouraging. What about for the future? Well, we got a lot of feedback. And practical issues came to the fore. The junior doctors had difficulties with protected time. They were getting bleeped away. So this year we've organised it that they're not allowed to be bleeped. Because we're an integrated trust, those of us who are teaching the course were not so good at using social care examples, and we're trying to change that and involve our social care colleagues in doing the teaching as well. Everyone wanted to be a mentor and progress to that, and that we can't always facilitate that, but it was good that that desire was there. They wanted fewer IHI modules, which is why we now have a customised module, because they thought not all of them were relevant. Greater junior staff, that's because at the beginning, the first course, we chose more senior people so that they would be engaged and then ultimately allow the more junior people to attend the course. So that's happening anyway. And the project choice freedom is always a difficult issue, because what we found is the projects often that people choose by their own volition are too complicated, too difficult and unrealistic, and often we have to provide a lot of guidance. But I understand that having freedom, and what we try to instill is that the rest of your life, hopefully you will be doing improvement and you can do your own projects. So where do we go for the future? Well, I want more primary care involvement. I would like GPs on our course. I would like the non-clinical staff to do a course, and we're going to have to run a parallel course for that. And I would actually say that we have truly changed our culture when I see a porter from our hospital with a poster downstairs, or even standing up here talking about their improvement. And that's a vision that I have for improvement in our trust. It's not just me that does this. There's lots of other people. Their pictures are here. They all have their involvement. They're all very senior, and you'll know some of them. And if I've never said it to you, and I know some of you are in this room, thank you very much. Thank you.
Thanks very much. Again, another one of the Trust prizes always somehow focus the mind. And it's, again, fantastic having your chief executive leading it.